In your book, Surgery, the Ultimate Placebo, Chapter 5 is called The Surgical Scrap Heap, Operations That Have Faded Away Due to Lack of Effectiveness. What was this about?
Here I go through a list of surgical procedures that are no longer being done because we thought they were necessary, but tests have shown that they didn't work. I actually take a little bit of liberty here, and I go all the way back through history and talk about things. And so I start off with bloodletting, and that's important for surgery because surgeons themselves used to do bloodletting. They would cut people with a lancet and bleed them to cure them of all sorts of conditions. And this was a mainstay of medical and surgical therapy for thousands of years, really. And it was never effective at doing anything except people thought it was effective. The reason they thought it was effective is because a lot of people got better afterwards. But of course, they would have got better anyway. In fact, some of them probably got worse because of the treatment. But I take it right up through, recent history and even my own training. And one example I give was when I was doing my very early surgical training, when I was a junior resident. I did a couple of terms on general surgery, and they would do mastectomies for breast cancer. And in those days, way back in the 80s and even earlier than that, in the 70s, there was this sort of race to do the most radical mastectomy that you possibly could. And so surgeons started off by taking out the cancer, and then they took out the whole breast, and then they took out the breast and the muscles around it. Then they started sort of lifting all the structures off the chest wall, and these were horribly, disfiguring, major operations. And it turns out they're completely unnecessary. It didn't really make any difference to the risk of death for the patient. It was just this sort of thinking, it sounded like a good idea that the more radical, and so surgeons would try and outdo each other with, how radical they could do these mastectomies. And these terrible disfiguring operations were largely a waste of time. And of course, they're not done now. Now, they would do sort of lumpectomies, things like that. But at the time, it was a good example of how something sounds like a good idea, but had never been tested properly. And unfortunately, that supports a lot of surgery these days, is that it's based on something that sounds like a good idea, but has not been rigorously scientifically tested. And when it is, it often fails.
In your book, Surgery, the Ultimate Placebo, Chapter 6 is called Today's Placebo Surgeries, Current Surgical Procedures Under Question. What was this about?
So this is operations that we are doing now. These are current, common surgical procedures that have not been adequately tested, certainly haven't been tested against the placebo, and maybe the operations that in 20 years' time we look back and say, gee, what were we thinking doing all these crazy operations? And so I cover a lot of things, some things that maybe don't work, like spine fusion for back pain, some arthroscopic keyhole procedures we do, like on the shoulder. I think that we might not be doing so many of them in the future. And some operations where maybe there is a need for it, but we're probably overdoing it. And I even talk about some obstetric operations like a hysterectomy and cesarean section, where and prostatectomy for prostate cancer and things like that. And I think there is some evidence that we've been overdoing these operations, because recent data shows that the rates of these operations, or many of these operations, are falling, which would indicate that we were probably doing too many of them. Not to say that there's no place for them whatsoever.
In your book, Surgery, the Ultimate Placebo, Chapter 7 is called Why Do We Still Do It? Reasons Behind the Persistence of Surgery That Is Not Effective. What was this about?
Yeah, this chapter is very important to me because this uh, lists the reasons why surgeons still operate, even though we know that the procedure doesn't work, or we highly suspect it doesn't work, or there's no evidence for it. And the question I get is, well, then why are surgeons doing it? Like, it doesn't make any sense. If you've got evidence that something doesn't work, how come surgeons are still doing it? Surely it must work, you know. And so I kind of take that apart and I look at the reasons why. I cover things like financial incentives, and certainly that's probably part of it, because we know that there's a big difference in the rates of surgery based on how surgeons are paid. And so spine fusion surgery is very common in the US because surgeons get very well paid to do that kind of surgery. In the UK, where surgeons are salaried and they get paid the same whether they treat something surgically or non-surgically, the rates are like 10 times lower. And so that, there's some evidence that there's financial incentives. Another reason is because surgeons don't always understand the science. People think that doctors are great scientists. They're not. We don't get taught to think critically and to think scientifically. I was not taught that. I had to go away and learn it after I did medicine and after I did surgery. And so a better scientific understanding would help surgeons a little bit make better decisions. But the bottom line is that the reason why surgeons still operate and do procedures that might not work is because the surgeons believe that it does work. And that sounds fairly simple, but what I'm trying to say when I say that is surgeons aren't going out there deliberately trying to deceive people. Surgeons don't wake up in the morning thinking, oh, I'm going to do a couple of these operations today, and I know it's rubbish, but I'm just going to get some money out of it. They don't think like that. I'm not completely cynical. I'm skeptical, but I'm not cynical. And I think that 99% of surgeons out there think that they're doing a good job and they're trying to do the right thing. It's just that they're not always right when they do that. And the example I give is I equate it to homeopaths. So homeopathy has been shown, scientifically to have sort of no effect. It's basically water that they're giving people, and they're relying on the fact that people get better anyway to justify it. But homeopaths don't wake up in the morning thinking they're going to go and rip off 30 patients in their clinic today by selling them rubbish. They wake up thinking that they're making a difference and that what they do really works. And it's no different with surgeons.